So you've got knee surgery on the horizon. I know that can bring up a ton of questions about what happens next. That's why we've broken down the entire recovery process into one simple guide. Think of this as your personal roadmap to getting back on your feet and feeling strong again.
Look, we know this is a pretty big deal, and it's totally normal to wonder about what comes next. Our whole goal here is to answer those questions and put you right in the driver's seat of your own healing journey. We're going to walk through everything, from the paperwork you need to do before you even get to the hospital, all the way to getting back to your favorite activities. We want to make all the logistics crystal clear so you can just focus on what really matters, getting better. Let's jump in. First things first, the prep work. Honestly, getting these things right before you even show up for surgery just sets the stage for a much, much smoother experience. Okay, here is your 4-point pre-admission checklist. About a week before your surgery, you'll want to finalize all your insurance details. Next, if you have any other medical conditions, you'll need to get what's called an anesthesia fitness clearance. Then, it's time to gather up all your important documents. Think OPD papers, MRI films, all that stuff. And finally, and this one is super important, make sure you follow all the pre-op instructions from your doctor. Ticking these 4 boxes is going to make your admission day way less stressful.
You're almost definitely going to hear this term, NBM. It stands for nil by mouth, which is really just the official medical way of saying you need to stop eating and drinking for a specific amount of time before your operation. This is a critical safety instruction, so you've got to follow it exactly.
And for that final prep right before you head in, it's all about hygiene. You'll need to shave the leg that's being operated on. You'll also take a special antiseptic bath with something called Chlorhexidine. You'll do it once the night before, and then again on the morning of your surgery. This is a huge deal because it helps minimize the risk of infection.
All right, surgery's done. The focus now shifts completely to recovery. Let's take a look at what happens in those crucial first 48 hours.
Now, this might be the most surprising part of the whole thing. Your recovery work starts immediately. Yep, there's no waiting period. Your active participation kicks in the moment you're out of the operating room. So what does that actually look like? Well, it starts with these 2 simple but vital exercises. Ankle pumps are absolutely crucial for keeping your blood flowing and preventing dangerous clots. And static quadriceps exercises, or SQEs for short, are all about waking up that main muscle that supports your knee.
And you won't just be lying in bed. The medical team is going to get you up and moving, very carefully, of course, with the support of a walker. This early movement is such a huge step because it helps cut down on stiffness, improves blood flow, and, believe it or not, actually speeds up your recovery.
Before you head home, you're going to get familiar with 2 more key exercise ideas. SLR, which stands for straight leg raises to build up strength, and ROM, which is for range of motion, to work on your knees' flexibility. These 2 are going to become a core part of your daily routine. Okay, let's talk about that transition from the hospital back to your own home. For the first few weeks, your top priorities are going to be managing your support gear and taking really good care of the wound. So, how long will you need to wear that knee brace? Well, it really depends on the exact surgery you had. As you can see, a straightforward ACL reconstruction usually means about 3 weeks in the brace. But if your surgery was more complex and involved a meniscus or fracture repair, you could be looking at up to 6 weeks. At the end of the day, your surgeon's advice is what counts. Besides the brace, you'll also have a crepe bandage for about 3 weeks to help manage swelling, and you'll keep on using that walker for anywhere from 2 to 6 weeks. Again, it all just depends on your specific procedure and how well you're progressing. Let's break down the wound care timeline. About 5 to 7 days after your surgery, you'll get a waterproof dressing, which is great because it means you can start applying ice packs. The next huge milestone is at the 14-day mark, when your sutures are typically removed. And that right there, that's the green light to officially kick off your physiotherapy. Okay, with that initial healing phase behind you, the focus now shifts to the bigger, long-term goals. This is really where you start to see all your hard work pay off as you build back your strength. Check out this journey all mapped out. It all starts at that 2-week mark with physio. At 2.5 months, you'll get a follow-up x-ray and can start some more advanced training. Then, by 6 months, you're doing a strength check and beginning agility work, which is pretty much the final step before you get cleared to return to play. And here it is, the magic number. Before you can even think about moving on to agility training, the quick, dynamic movements that mimic sports, your operated leg needs to have regained 90 to 95% of the strength of your other uninjured leg.
This is an absolutely critical benchmark for preventing another injury down the road. I really can't emphasize this enough. Hitting that 90 to 95% goal is not something you do on your own. Supervised physiotherapy is essential. And yeah, it's a commitment. You'll be working with a professional for at least 2.5 months, and you've got to follow their prescribed plan to the letter.
Whew. Okay, that was a lot of information, I know. So let's bring it all together with a quick reference guide that has the most important takeaways you'll need day to day.
These are your foundational four, the exercises you're going to start with right away that form the base of your recovery. Ankle pumps, static quads, straight leg raises, and range of motion exercises. Keep this list handy.
And here's a super clear guide for your medications after surgery. You'll usually stop any regular meds 5 days after you get home, unless, of course, your doctor tells you something different. For pain, you can take a 500 milligram Crocin tablet as needed. That's what SOS means.
And finally, please remember that this recovery is a partnership. If you have questions, if you're feeling unsure about something, or when it's time to book that 2-week follow-up, this is the number to call. Seriously, go ahead and save it in your phone right now. This whole journey, from the pre-op prep all the way to that last physiotherapy session, it's all leading to one thing: getting you back to doing what you love. So as we close this out, I'll leave you with a question to keep you motivated. What's that first thing you're looking forward to doing once you're fully recovered and cleared to play? Keep that goal in your mind. It's the best motivation there is.